Gastrosurgery UK's Guide to Post-operative Care for Hemorrhoidopexy or Hemorrhoid Treatment. Immediate post-operative period. Recovery room monitoring. After the surgery, you will be monitored in a recovery room until the effects of anesthesia wear off. Pain management. Adequate pain relief will be provided. Follow your healthcare provider's instructions for pain medication. Activity and rest. Rest and avoid strain. Rest is essential in the initial days. Avoid strenuous activities, heavy lifting, or intense physical exertion as advised by your surgeon. Gradual resumption of activities. Start with gentle walking and gradually increase your activity levels based on your healthcare provider's recommendations. Wound care. Keep the anal area clean. Gently clean the anal area with mild soap and water after bowel movements. Avoid harsh wipes or excessive wiping. Use sitz baths. Consider taking sitz baths, sitting in warm water, to soothe the area and promote cleanliness. Follow your surgeon's recommendations regarding the frequency and duration of sitz baths. Diet. Gradual resumption of diet. Start with a soft or bland diet and gradually reintroduce regular foods as tolerated. Hydration. Ensure adequate hydration, and include high-fiber foods in your diet to prevent constipation. Medications. Pain medication. Take prescribed pain medication as directed by your healthcare provider. Stool softeners or laxatives. Use stool softeners or mild laxatives as recommended to avoid straining during bowel movements. Follow-up appointments. Schedule and attend follow-up appointments. Attend all post-operative follow-up appointments with your surgeon for wound checks and assessments of your recovery. Activity restrictions. Avoid heavy lifting. Typically, avoid lifting heavy objects for a specified period to prevent strain on the surgical site. Minimize sitting for prolonged periods. Minimize prolonged sitting to reduce pressure on the surgical area. Watch for complications. Monitor for signs of complications. Be vigilant for signs of complications, such as persistent or worsening pain, bleeding, fever, or changes in bowel habits. Contact your healthcare provider if any concerns arise. Driving restrictions. Avoid driving initially. You may need to avoid driving for a specific period, especially if you are taking pain medication. Return to work. Follow work restrictions. Discuss with your surgeon when it is safe to return to work, taking into account the nature of your job. Always follow the personalized instructions provided by your healthcare team for the best recovery outcomes. If you have any concerns or experience unusual symptoms during the recovery period, promptly contact your healthcare provider.